we are on tip number 5 of 5
Mm-hmm.
for ways to prepare for hip replacement surgery. And tip number 5 is pre-hab exercises.
Yes.
Pre-hab.
Yes.
Not rehab, but pre-hab.
Yes.
Yeah.
So
Tell us about pre-hab. We touched on it a little bit earlier. So
Yeah.
pre-hab,
So
but let's go into a little bit more detail.
it's just really talking to your surgeon about, what can you do to prepare for surgery
Mm-hmm.
for your best outcome. So,
I love
they're
that.
gonna know your case, and they're
Yeah.
gonna know what they want you to do or what they don't want you to do. Some may say don't do this, but do this. But if there's some strengthening exercises or some range of motion exercises that you can be doing prior to your surgery.
Yeah.
And again, we touched on just the health in general. With smoking, if you're a smoker, you need to try to quit smoking.
Yep.
Not try, but because the surgeon's probably going to make you do that. Just FYI, heads
Yeah,
up.
that's true.
They may talk to you a little bit about weight if you need to lose a little bit of weight. But all of those things are going to set you up for the best possible outcome.
Yeah.
For your surgery. And these surgeries, like I said before, are majority, 99.9% of these surgeries are very successful.
Mm-hmm.
But every individual is different, and you want to prepare yourself for your best outcome.
Absolutely.
Mm-hmm.
And it seems, with hip surgery, there are some, and same thing with knee surgery.
Right.
I mean, you're made up of muscles and stuff.
Right.
So, but with hip surgery, there are some exercises that you could do pre-surgery to help strengthen the muscles around the hip joint.
Right.
That your surgeon, or have your surgeon maybe refer you to a physical therapist before you go into surgery and kind of get that set up.
Right.
And maybe they could recommend some pre-surgery exercises. Yeah.
Mm-hmm.
We did talk about in another video, some of our other contents, and we talked about the Trendelenburg gait pattern.
Right.
Yeah.
Right. The Trendelenburg, positive Trendelenburg, hip weakness, and a lot of times you see people with osteoarthritis of the hip that it's kind of a precursor that starts that whole process that may lead to a hip replacement.
Yeah.
You see that frequently in those clients just because of pain over the years, and you kind of adapt how you're walking, and it can result in weakness in the abductor muscles. So it's kind of a related thing.
Yeah. Sin, that reminds me of whenever your dad had knee replacement.
Yeah.
And you knew you could just tell, anybody could tell with the way his gait pattern changed,
right,
that he was in pain. He had pain in his knee.
Right.
I mean, he kind of had that waddling gait, I think, from the knee pain. But then even after he had the surgery, because it was such a habit for him at that point,
right,
he still had that gait pattern that he had to
had to overcome, because it becomes a habit. It becomes a habit, and your therapist works with you on that. But it's a habit that forms to avoid a certain thing, and usually it's pain. And then when you avoid a certain thing and you're moving differently, then the muscles that typically do that normal thing become weaker, and so it's kind of a cyclical thing.
Yeah.
But it can be worked out. It just takes a little time.
Yeah.